Your urgent suspected cancer referral. You may be wondering why you've been referred to hospital on an urgent referral pathway. There are several different ways in which this might happen. You may have been referred through your GP practice. If that is the case, you will have usually been checked by a professional at this practice, often a doctor or a nurse. They will have considered your symptoms and test results and decided that further tests or an expert opinion are needed. The practice will have written a letter explaining what has been going on to the hospital specialist, who is usually a consultant. If they agree that you need to be seen quickly, then an appointment will be arranged. You may have been referred following a screening test through the National Screening Programme. This is usually done directly by the screening team and not by your GP practice. You might have been at the hospital with another symptom and your specialist has decided that you need some further tests by a different specialist team. Most patients referred on urgent pathways will not have a serious cause found for their symptoms. A small number of patients with these symptoms or test results will be found to have a cancer. The aim of these urgent pathways is to identify these patients quickly and to rule out cancer in others. So what happens next? You will usually get a letter, phone call or text from the hospital clinic to invite you for an appointment. Sometimes the appointment will be to see a specialist who will want to find out more about your symptoms and may arrange more tests. Sometimes the first appointment will be for a scan or other test. This is sometimes called a straight-to-test appointment. These urgent appointments are very precious. They usually happen at short notice, and if they aren't attended, they usually can't be given to someone else. This means longer waiting times for everyone and is a waste of NHS resources. What if attending the appointment is difficult? If you know that you are going to be away in the coming weeks, or have carer responsibilities, or other reasons why it might be difficult to attend, then please tell the clinician who referred you to hospital so that they can mention this in their referral letter. When you receive the appointment, if you are unable to attend, then please telephone the number on the letter or follow the text message instructions to cancel so that the appointment can be offered to someone else, and advise that you would like to arrange a new appointment. Remember, these appointments are offered quickly as they are trying to rule out cancer. Finding cancer early gives the best chance of recovery, and so attending this appointment should be something that you prioritise where possible. What will happen at the appointment? If it is a straight-to-test appointment, you will be sent instructions for any preparation that you might need to do before the test. For clinic appointments, you will be told when to attend and then the clinic location. Remember that parking at the hospital can be difficult, so please allow plenty of time to get to your appointment. During a clinic appointment, a doctor or sometimes a specialist nurse will usually recap your symptoms and ask more questions about what has been happening. You may have an examination and sometimes more tests will be arranged. These are sometimes for the same day or the following days. The hospital team should then write back to your GP to tell them what has happened. If the hospital team are happy that there is nothing serious going on, they will discharge you from the clinic and let you know that this is happening. What should you do now? While waiting for your appointment, it's a good idea to use this time to make sure that you are as well as you can be. Click on the links to our other videos. Thank you for watching. For further information on how to prepare for your upcoming appointment, please watch our other videos. Please give this video a like if you have found it helpful.